The Deputy Public Protector has found that patients at Port Elizabeth's Livingstone Hospital were fed inadequate food. There's only one oxygen port at Uitenhage Provincial Hospital. Also in the Nelson Mandela Bay Metro, they shared this oxygen port, scores of patients that is. The overwhelmed laundry facility at Livingstone was also hit by rampant theft. Advocate Kholeka Gcaleka is the Deputy Public Protector. She joins me now via Skype to discuss some of these issues. A very good evening to you, Advocate, and thank you so much for speaking to us. Now, I believe that you were generally shocked by your findings. What in particular disturbed you the most?
Good evening, Sepis, and good evening to your viewers. What is enormously disturbing was the state of the hospitals. They were in a state that they were really not an enabling environment to the essential workers at the hospital to provide an effective and efficient service to the members of the public.
So we'll talk about an enabling environment in just a moment, because I want us to take it chronologically, just in terms of some of the things that you've highlighted. You spoke about a state-of-the-art kitchen that was built at the Livingstone Hospital for the 2010 FIFA World Cup. Now, one is imagining that if it's going to be used in this day and age under such circumstances, some necessary upgrades would need to be made, or at least ensuring that the resources are up to speed. Did this happen?
Tepisa, the kitchen was abandoned since the 2010 World Cup. So at this stage, they just know that some of the trolleys that they have in that kitchen are actually not even available in the market anymore. And they've never been utilized since 2010. Reason being, they do not have the staff complement to be able to be a resource to the kitchen of that caliber.
I mean, surely that should amount to wasteful expenditure. And if that's the case, who should be held accountable for this?
Should that be the case, at this stage, we are unaware who had installed the kitchen, because certainly an assessment should have been done in respect of its viability post the 2010 World Cup.
I mentioned just some of the issues that you'd mentioned: a collapsed laundry service, theft of linen, patient gowns and sheets, etc. But I want to find out who faces the most challenges at Livingstone Hospital and why.
Well, it would be both the workers and the patients as a result of the workers not having effective and efficient tools to deliver the service that they are supposed to deliver. For instance, if and as it is in this state, the shortage of oxygen, patients who arrive at the hospital requiring that particular service are not able to get it if there is another patient who is using the oxygen port. And it also becomes a frustration to the nurses and the doctors who need to run in between transporting the oxygen port from one area to another.
And I'd imagine that that would mean that social distancing is either virtually not in place, or it's just there's no conducive environment to do that.
Not at all, especially during the peak. They could not maintain the social distancing because of the shortage of space.
Does this come down to management instability and inefficiency?
It is a management instability in the sense that in 3 of the hospitals that we visited, most of the senior managers are actually acting. In Uitenhage, the acting CEO just started about a month ago, and it became clear that she was not well conversant with the challenges that are facing the particular hospital. So in that instance, if management is not stable, operations also become challenged.
So that should then extend also to a leadership challenge, isn't provincially, because you can't have so many vacancies that are outstanding for so long, especially at the higher echelons of the management of these institutions.
That's what the management reported to us, in fact, that they would submit the post-establishment, the vacancies to the province, and it would just not come through to be processed at the provincial level.
The situation in other places, in Uitenhage, in Mthatha and Qumbu, what were the findings there?
The observations that we made in Uitenhage, for example, they are also a small hospital. There is also a structural challenge at Uitenhage, as Uitenhage is supposed to be a regional hospital. However, it still is not properly established and resourced as a regional hospital. Hence the shortage in equipment, in staff, that's supposed to service the hospital. We found the same at Umthatha General. Umthatha General was also proclaimed in 2012 to be a regional hospital. However, it still functions as both a district and a regional hospital as a result, taking out services of both level 1 and level 2, yet they have very little resources to effectively execute those services. And at Qumbu, the situation in that hospital is terrifying, and that is the report we got from the management and the workers themselves, that they are actually working in a scary environment. The building is dilapidated. There was a contractor that was appointed in 2018 who did not complete its work. There was then a new construction company on site. However, there's very little done. The management has, however, been promised that the construction will be completed in 2 months.
Thank you so much. Wish we had more time. Deputy Public Protector Advocate Kholeka Gcaleka. We're going to take a